versus having to stare into a computer or a notepad. And then it also provides the opportunity to standardize note-taking in documentation across a number of clinicians within a practice. I know myself, I was never a great note taker, and AI Scribe has really helped me even in my business meetings. So some of the key features that are really relevant for the industry and some of the benefits that you can pull out of the product mix is that the importance of custom note flexibility. Be able to author the notes in the way that you may do it manually. So that flexibility within an application, within a software is absolutely critical. Also being able to mimic the writing style. So over time, as a practitioner, you likely develop the style that you like to write in, or perhaps one of the beauties of the application is you can now start to mimic a style that maybe you'd like to write in. Maybe it's something that doesn't come natural to you, but the application can help you derive a style that you may want for your professional notes. There's some other key features that are fantastic as well. You can use archive material, so if you have audio or video notes that you want to transcribe and get summarized, this service can actually allow you to do that and take even archive material or handwritten notes that you may have had from the past. You can upload any document, any type of video, PDF, text, or even image files. So if you had handwritten notes or hand-drawn photos, or even more medical style notes or documents like blood reports, you can now upload those and summarize them. And then, of course, we've got APIs that are available for integration if you're looking for more workflow management, and insurance codes for ICD-10, ICD-10-CA here in Canada. So I think the feedback has been really exciting for AI Scribes. Just overall, I can point to a few of them that, the industry, everyone is just super busy, and this certainly helps reduce the time on notes. It's very easy to just run from your laptop. You can use a mobile device. There is a mobile version, and it's, at the end of the day, it's really not that expensive. We have packages in CliniScripts that are $4 or $100, and if an appointment, you all know what you charge for an appointment, and the revenue opportunities and the savings, the ROI is very clear. So if we're talking about CliniScripts, it is definitely focused for the mental health space. There's scribes all over the market, whether they're just general scribes for any number of subjects. I think all industries are starting to look at this very, very closely. Medical scribes, there's a very crowded market, no doubt, but certainly very specifically for mental health or some of the other allied health disciplines, CliniScripts is very well positioned for those markets, and all of our R&D is focused toward those industries. So on that note, CliniScripts, we've got a solution that is well designed for mental health, and always putting privacy. I think that's the number one question that often comes up. Privacy, quality, and the flexibility in your note authoring is really at the core of the meeting, of the offering, and it can handle all of your workflows and just make your life balance that much better. I'd love to know, and the audience would love to know, before you had started trying with CliniScripts, what were your biggest challenges and problems that you faced with regard to your documentation or some of your burdens within your practice?
Writing notes. I had a practice of, I do my notes at the end of the day. And after seeing 5 to 7 clients in a day, especially the 7 client days, I'm exhausted at the end of the day. And the last thing I want to do is notes. And sometimes I wouldn't get them done that day. And what I would notice is that if I didn't have them all finished by the time Friday came, then I could feel the pressure hanging over my shoulder over the weekend, and often up early on Monday with a little bit of anxiety because I hadn't finished the notes from the previous week, and jump in and do that. As well, I join you, Michael, in I've always had some discomfort in the notes that I have written and whether they might measure up if ever I were audited by my college, as SERPO, College of Registered Psychotherapists of Ontario. My primary training over 20 years ago was Gestalt, and that was very much experiential based, and I would not trade that training in any way, shape, or form, because we looked at a client holistically, so somatically and cognitively and environmentally. It was pretty weak on the note-taking instruction. And myself and many of my colleagues have some discomfort about sharing notes. So that was also something, if ever a client were to ask for some notes, there'd be a little discomfort inside. So that was also something that sort of hung in the background, a little bit of discomfort. And lastly, as well, as I am aging and my memory is not quite as good, I have had more of a tendency in the last few years to have a notepad beside me while in a session, just to jot down a few points. I didn't have to do that earlier, but now I do find that that's helpful. And that takes me away energetically from what's going on between me and the client, which is a barrier. And I strongly believe that it is important to be as present as possible at all times with myself and with the client, and paying attention to the relational field. And even if I'm just taking a moment to jot something down, it interrupts that.
No, that's a wonderful account of where the note-taking has been and where it's taking you, and I guess that leads into my next question. Once you started using CliniScripts, can you think of a time or potential story of how CliniScripts has really helped you, and you've seen it, how it can really work for you, and what has this meant to you?
There's a couple of areas about this. I remember the first day when every session I had, the client had allowed me to use CliniScripts. And so at the end of the evening, I didn't have any notes to do. And I felt like a kid skipping school in the fact that I was able to go home at that point an hour and a half earlier than what I would normally do. And it really has shown me how much energy was spent in even just the thinking about the doing notes and then the actual doing notes. And so it has freed up so much time and energy on that front. As well, it has been very, very timely because I have been in the process of expanding my therapy clinic to incorporate offering ketamine-assisted therapy legally. But that has meant that it's almost as though I've had two jobs as I work towards meeting regulatory compliance in tripling the size of my therapy office. And that, since using CliniScripts, that has released that energy and allowed me to divert that energy into dealing with a lot of issues and learning and supports I've had to put in place in order to offer this new treatment modality. And I don't know that I'd still be standing if there hadn't been that ability to direct the energy elsewhere. The last piece that I've really found beneficial is I no longer have any issue if a client asks for notes. When I say issue, I mean, of course, the notes are the clients, and so I've always provided them when they have asked for them. But now it's like, yeah, sure. And so that facilitates that piece in if a client would like a record of the note from the session. And I think one other piece as well, because my training was not substantial enough in how to write proper notes, the notes that CliniScripts provides for the most part really helps me view what I'm doing in a more I don't know, I can't think of the right word, but it puts it into a framework where I'm able to say, hey, I'm engaging in reflective listening, and hey, I'm even engaging in some CBT, and I'm engaging in cognitive restructuring and terms like this that I did not have top of mind. And that, just as a side note, is really going to help when I do my case-based assessment for SERPO in April, in being able to use those buzzwords in describing what I do when I see clients. Now it is very much just automatic, and I use my intuition in how to proceed with the client. But having that framework and that phrasing to use also really helps to give me confidence in what I'm doing in the eyes of a third party.
That's an amazing account of how it's started to benefit you. And I'm curious, have you, as you start to get into the technology, have you tried any other softwares or any other solutions that you could possibly compare it to? And how does CliniScripts stand out from other providers?
I haven't tried any others. I am a bit of a technophobe. This is one of the reasons I jumped on so quickly, is because Shahan came by and dropped off a note at my office. And as well, I saw that the professional association that I belong to, Ontario Society of Registered Psychotherapists, also put out something about CliniScripts. So those two things coming together led to me inviting Shahan to come and do a video demonstration for me. And it was so easy that it just blew past any barrier that I had in even trying to figure out something by myself. Even though I see how easy it is, I can have an initial, oh my gosh, resistance to it in fear that, or a belief that it's going to be more complicated than it actually is. So seeing it happen right in front of me was absolutely instrumental.
Well, that's fantastic, and we certainly appreciate those fantastic words. And I guess just lastly, how comfortable would you be to recommend this to a colleague or a coworker? And is this something you can see the community jumping onto?
Yes, with some reservations. So privacy, of course, was really important. And one of the things that I took some comfort in, even though it was described that none of this was going up into the cloud, that privacy was being maintained, and then when I would clear a conversation, it was gone and there was no record of it. In working with some of your software engineers, recognizing that one of the glitches that I was encountering was due to not having enough RAM on my laptop. which proved that everything was happening right here on my laptop. And by increasing the RAM on my laptop, it took care of those glitches for the most part. That is something that helps to reinforce what you're saying about privacy. There have still been a few glitches. One thing that I've found is it's very much set up like a medical model, and my own personal style as a therapist is much more human to human, as opposed to having sort of a medical hierarchy where I am telling the client what to do. And I have found that the whole team has been very, very open and wanting feedback about how this can be a little more therapist friendly and moving and a little less of a medical model. Now, in this expanded therapy clinic that I'm putting up, this actually will be quite beneficial because I hope to offer this to everybody in the clinic, and there will be medical professionals, doctors and nurse practitioners, as well as therapists, all working collaboratively for the best interests of the client. So I can see the benefit of both having a more therapeutic framework for notes as well as the medical framework.
And that really is great feedback. And of course, we always love to hear feedback from anyone that's using our customers and anyone on trial, because it's an evolving technology, and the great thing about it is there's room for both, where we can very quickly adapt to the note styles for the various designations and the style of note that one needs. So it's really great to hear this kind of feedback, because it's a pretty easy course correction for our technical team to start to adapt and make sure we have everything that the community at large needs for their note taking. So that's excellent feedback. Well done. That was a wonderful account. Thank you so much for joining us for the session today. We really appreciate
Dr. Holloway. Let me start by asking, what are some of your thoughts, if not specifically for mental health, what are your thoughts about how AI is currently being used, and maybe some ideas of where you think it might be going? Where do you want to use?
And by background, I'm a hospitalist. I've been for over 10 years and a physician leader at multiple different levels, and started a company trying to figure this out. Because there are the companies that are creating this technology, and then there are the people that are supposed to be using it. And sometimes those don't mesh. And so in the work that we do at Advantage, we meet lots of folks on both sides. And I think your point about using the technology, understanding the technology, and its potential limitations are very, very important. We've heard of hallucinations with AI, and that can be funny and can also be dangerous if not reviewed appropriately. So I think some things that I'm seeing very commonly, the medical scribe, as was discussed, we're going to hear a little bit more about that, has been tremendous in helping in the work of seeing a patient, but also having time to be in front of the patient and have a face-to-face conversation without worrying about a pile of notes that you have to figure out how you're going to get through after the day. So I'd say that's probably one of the most common ones I see. I think chatbots on the patient experience side, we see quite a bit of that, which some people love it and some people don't. I've seen some generational differences in that as well. And a lot of the work that you mentioned in radiology, I'm seeing that in multiple places throughout the country.
Well, you're also in the health system. What are you seeing? It's something similar or something different?
Yeah, my name's Dr. Hendo. I wear blue hats. I'm a primary care nurse practitioner here in Toronto. Also on faculty at U of T in the nursing program. And what we've been seeing is a lot of the use of the AI scribe. I was mentioning to the other panelists earlier that when AI scribing came out, we really jumped on it. Like, oh, this is fantastic. This is going to cut all of our time and everything. And then we had to think about policy and procedure and things like ethics and bringing in legal. And now there's been a bit of a clawback. So I think our organization specifically is trying to work with both clinicians as well as patients and patient advisors to go about this in a way that's ethical, in a way that does take away from the stress associated with documentation for clinicians, but at the same time also doing it in a way that's protecting both the patient and the clinician. To your point, I love that point about review with the AI, right? That's really big. A lot of people just tend to the AI scribe is recording the entire encounter, but you need to go back and review. And similar to the point about the radiologist, if you have to go back and review, that's when you have that tension. People are like, well, I'll just write it myself. So there's got to be a way that we can incorporate AI into our clinical practice that we know it's effective for reducing the stress for the clinician, but also doing it in a way that's ethical and helpful for the patient.
Wonderful. So aside, as you wear a few different hats. I know one of them is a registered psychotherapist. Can you address the question from your point of view?
Sure. So my name is Maksha. I'm a registered psychotherapist in Toronto in private practice, and I do love it because I do not like writing notes, and also because I'm an integrated psychotherapist. I use a lot of different approaches. My dashboard is quite wide, so it's not just one methodology that I can really tap into. And what the CliniScripts scribe that I've been using has been helping me with is to just write it down in a way that is an acceptable form of case note for the CRPO, the regulatory college. And then I can add the nuances that maybe it missed, or the moments that I thought were important, or what I did maybe slightly differently to it. But it has cut the time from 10, 15 minutes, because I tend to go very deep, because I'm also an in-depth long-term psychotherapist.
10 to 15 minutes per patient?
Per patient to 1 or 2. So I'm actually quite grateful.
Wow.
So
what's that per day?
Oh, it could be anywhere. I don't see more than 5 or 6 clients a day. It's really not possible for my brain.
Okay.
I don't have AI in here. But
that's still for now.
It's quite a bit of time. Yeah. But also just holding all that information. Now what I do is I have a very good contextual memory, so I don't really need to remember from session to session. But when it comes down to having to write all of that, everything that happened in one session in 15 minutes into a small note, what the AI tool is helping me with is to do that for me, then I can fill in the gaps.
Interesting. So it's not just the speed, it's also the mental energy of
Yeah,
the day as well.
Yeah, the summarizing, the distilling.
Hold the thoughts for later documentation.
That's right. Yeah, and now I can just be very fully present actually in the session. Without really going like, oh yeah, this, I had that, we had that. I'm not keeping mental notes.
That's what you're seeing in the organizations you work with.
Yeah, so thank you, Michael. So, good afternoon. My name's Chris Berger. I'm a partner with Ernst & Young in the healthcare consulting practice. So I'm a national team as well as a global team. Over 20 years in the healthcare space, both in the UK, US and Canada. So for us, AI is interesting. We're hearing a lot of examples already around use cases and how we can actually deploy AI with organizations. A lot of our work we're seeing is a few steps before that. You've already mentioned the policy aspects of that. So do we have ethical frameworks? Do we understand the accountability and the fairness? Do we have data privacy? All lined up, really understanding the organizations and how actually taking that data and then applying that through these algorithms. Again, we're seeing organizations develop AI sometimes disconnected from the rest of the data ecosystem. So have we understood where the data is coming from? Do we have data fluidity and the infrastructure within the organization to actually support large-scale adoption and use of these tools? And with that, are we designing new solutions with those infrastructures in mind as part of that to enable that spread and scale? So again, how do we make sure that we're not doing this in isolation? How are we connecting this wider organization? but being cognizant of biases, ensuring the positioning of the center. Yes, we've got that clinical note, but you're still taking accountability for the output and the outcome of that note, and finding your own comment on it, not just relying on the outcome at face value, but actually looking at that and really seeing what's coming out of the answers from whatever area. So for us, it's really around supporting organizations on that journey, really from front-end policy and strategy side all the way through to sprint scale and adoption of those solutions.
Great. Dr. Galloway, in your organization, I assume some people, as any big change, take the technology faster than others. Are you seeing variation in how readily some do and some don't take to the technology? And if so, what do you think is the determinant for whether people jump on it or shy away from it?
Yeah, you're spot on. There are definitely differences. And I would say, especially in healthcare, it's no different from when electronic medical record started. My mom's a nurse, and we were talking about this just the other day, and how many nurses and how many physicians retired because the computers were coming. And so now the AI is coming. And I think it's people are a little less concerned and maybe scared from that standpoint and learning something new, because it does seem that when working well, it would be integrative. But I think to Chris's point as well, the privacy aspect, there's concern around that. There are lots of clinicians that are worried they're going to lose their job. There are concerns that some of these tools may not be created in mind in the way that implementation makes sense, as was stated earlier. I know that's a lot of what we do too, is yes, this shiny object is awesome, but is it awesome here? And if it can work here, how can we integrate it into the current workflow? And I think that's the big piece. When it's done well, people take to it. You have that time to review, explore, expand, optimize. But when not done well from jump, people tend to kind of not want to hear it. And, oh, AI, they're coming to take the jobs and they're scamming me and I don't want any part of it. So I think a lot of it has to do with what is it? Is it solving the right problem? Because that's the other thing we see. If this is going to get rid of me staying up until 2 o'clock in the morning writing my notes, I am willing to try it. And we do see that. And so the more thought that goes into the product ahead of time, and thought in relation to the patient, the clinician, the finances, all of these things at once, the more likely it is to survive and to be successful in the space.
Tell your situation of having started with it and then pulling back for good reasons, but still pulling back, makes me think about some of those enthusiastic end users who may have actually been saving a bunch of time and are not now. How do people respond to the pullback, and particularly things related to the administrative work? What did you find there?
Yeah, so at our organization, a lot of people who were early adopters, and when there were so many AI scribes that were coming out, and they kind of just were like, oh, I can register and just bring this on and start using it in clinical practice without the policy and procedure being put in place. It's been really frustrating for them, because the evidence is there, is that it's able to really reduce that clinician burden. And for somebody to now, especially in a quote-unquote post-COVID world, to say that we were implementing a strategy that's actually helping clinicians get some wellness, enjoy it, or just kidding, take it back. It's really, really frustrating for people. So I'm happy that we are actively engaging in creating that policy right now, but it is extremely frustrating. And to look at the future of it, being to Dr. Welle's point that potentially this might even be integrated in the way that we just do practice on a go-forward basis. It must be really frustrating for the people who are early adopters. But again, our new medical nursing psychotherapy students are going to be probably using this within the next 1 to 5 years, the standard practice of their education. So hopefully we can get this ball rolling a little bit faster in a safe way.
Great. I thought I was going to ask you about your mental health perspective. You practice on climate, per se, but you really do have that mental perspective. What's your sense of what's different about mental health needs versus, say, some of the others There's so many products out there in some ways.
I think it's the diversity of mental health approaches and services. It's the diversity of psychotherapeutic approaches. So what I've noticed is that a lot of the AI have picked up on, for example, cognitive behavioral therapy, but not necessarily on other approaches. So they're not going to pick up on the interventions that their misuses that include the other approaches. So that is going to come, hopefully, and I believe it will, because it is getting smarter and smarter. And I think the other piece would be for especially psychotherapists that are really taught about privacy of information, and they're incredibly protective of their clients' information and lives and stories, is that element of trusting that the data is not going to be anywhere else. That's number one. And number two is when there are technical glitches. So all of a sudden, I have the scribe and the data is gone. I don't know where it went. And that is a very legitimate moment of panic for psychotherapists who sworn to privacy. So those are the things I think that if we can, I usually I put in the vague conversation toggle on to make sure that there's nothing that's being, that's compromising. And I keep telling myself this is still a new technology, so I have to be patient with it. Just like me when I was a new therapist and I was messing up all over the place, and nobody said anything. Got lucky. It's kind of similar to that in a way. So those are the two I would suggest. We need to really pay attention looking forward for mental health.
So, Chris, I mentioned in my talk how predict the future so far. And you're a consultant. You guys see the things that others don't see. Tell us what does your crystal ball say?
It's a dangerous question. And as we were just talking about this beforehand, the organizations teams trying to predict the future, but just by inherently trying to do that, they change the course of the future by now. So putting something there that says in 3 months X is going to happen. Well, does that now mean I need to do an intervention 3 months early? Does that actually change the course of that patient journey? Have I actually removed that event? Have I just done something, a medication for a reason that may not ever actually happen? So it's very interesting just around just going on the AI side of the future prediction piece, sort of seeing that side of the world starting to wake up and people trying to get ahead of the game on that. And it's an interesting sort of ethical question around the implications that will have for sort of care pathways and physicians to potentially sort of say, should I do something? In terms of I suppose, the future of AI, it's going to be here. It's not going to go anywhere. Dr. Whaley, I think your point around, is this going to replace physicians? And the statement earlier from Jeff Hinton, I don't think that's going to happen. I think what we will see is augmentation of physicians with AI. I think if you go 5-10 years out, I think people will be sort of saying, if a physician isn't using AI, that would be more risky than a physician. But we've got to get through the trust, we've got to get through the data biases, the hallucinations, etc. So that what we see is that it's actually working. In terms of solutions, we already mentioned the scribes, but I think there's some technology that's there today. It's already starting to get commoditized as well, which is going to be highly beneficial for the medical system in that regard. Using that and used in the right way. I think the future there is going to start to step into more therapeutics. It's going to be the cognitive therapies we're alluding to, and predictive. Mentioned the radiologists. I think we're going to see more depth and expansion into those types of fields, especially with mental health. So another use case that the pros and cons of this is non-verbal cues. So can we use AI to translate non-verbal cues as part of care pathways to actually help accelerate and enhance patient experiences in sort of mental health space?
Yeah, I think that those non-verbal cues is when the AI is also looking at the video, not just listening to the audio. That's really going to be a big differentiator. I just wanted to also add that patience, I think, needs to be also offered to the companies and the startups to be patient with what they're offering and not be too impatient about putting it up there, because the danger is real. Like losing data like that is is a real danger. And I think that's something that as startups need to pay attention to and not take lightly, like, oh, we're just testing it out. Yeah, but you're also playing with people's important private information, health information.
So as we think about this in relation to patients, in terms of people being patient, one of the questions that came to my mind is, what about patients? And they're seeing this technology both in the exam room and in their homes. What's your perception of how patients are reacting to healthcare's adoption or lack of adoption? Are they open it up for any negative elements?
I can start.
Chantal, please.
Yeah, I think what's needed, or what I'm seeing, is that. Oh, sorry, something I'm question on. I'm not sure. But anyways, I think what I'm seeing, and what's needed, is that patients are having concerns about their data and what's happening to it, and if it's being used to train machine learning, or is it just for us to keep, or is it just for us to use for documentation purposes? What's happening with the recordings? What's happening with the data after we're done with the encounter? And I think that, to your point about startups and everybody, jumping on this generative AI or on this scribe or whatever we're going to be using for therapeutics, transparency is going to have to be key in order to establish trust with our patients. So I think if organizations just get ahead of that, because as we've seen with, I will not mention the other social media companies that have, where like, yes, I want to post my pictures for my friends. Yes, I'll accept. And that data was used in ways that we as a society did not realize. I think it's going to be really important that organizations are transparent to move this forward in an ethical way. Yeah.
So you're using it in front of patients, obviously, and we're probably one of the most sensitive areas. How are patients responding in your environment?
95% okay. Most of the people that I work with, this is an example, and you have to consider, the fit, right? People that probably want to work with me, maybe are also okay with AI. There's that level too, but so I don't know for the rest of the population, but for mine, maybe one person has said what's happening to the data. The rest of them said, yeah, I understand. And I explained to them, so what happens is I clear the conversation. It's clear based on what CliniScripts told me. So, and it's been fine. They've been okay with it.
Wonderful.
Yeah.
Dr. Holloway, have you had any experiences with patients reacting to what you're doing, or other what you're doing?
Yeah, I've had this discussion with other clinicians, specifically around the AI scribe. And, well, do I need to tell the patient? And I think that goes back to Chantal's point too, of this is happening sooner than, as Chris said too, the ethics and the rules and policies. And, there was nothing in place. And so it's a real question. And I think, well, we tell the patients not to record us. Almost like they do anyway. But if we're recording, we need to let them know. And not let them know, ask them if they're okay with it. And I think that's an important piece to the point about social media and just looking. Yeah, I think both the healthcare industry and the tech industry do have an obligation to clearly as possible explain the benefits and the potential risks of this type of work. I think there are areas where it's so important, looking at rural medicine, folks that don't have access as easily as others. But there are opportunities there even to isolate folks as we're creating programs that we're hoping are going to include more. So I think, again, the point about being very intentional about what we're doing, why we're doing it, how we're doing it.
I want to give a chance to open up any questions from the audience. See if anyone wants to ask any questions. Please.
Sarah, do you want to coordinate the questions, and maybe we can take one or two questions quickly before we go to the next one?
There wasn't any question for the panelists right now. Yeah, you can continue. I see that someone has raised their hand. If you want, we can take that question, but there isn't any in the chat box.
Anybody else? So let me, I think there's a couple of questions that we have. Sean, go ahead. Yes, we can hear you, Sean. Go ahead.
Wonderful. Well, thank you very much for this presentation. My name is Dr. Sari. I am the Assistant Chief Medical Officer at Center for Family Health and Education. We've been using AI for about a year or so, a different platform. In our organization, has been significantly successful. Obviously, going through changes, everybody complains about it, but overall, I think it's a light years ahead compared to what we used to do back in the 19th century. Writing notes on tablets, etching notes. In any case, but that's not what I'm calling. I just wanted to make a comment about the discussion that we're having. We dealt with this issue of should we let the patient know, should we not let the patient know, and this and that. Obviously, that's actually letting them know. But letting them know means that I have to spend another 10 minutes explaining that this is not a recording, this is not going anywhere, this is just a transcription. The word recording is a misnomer. It's very similar to court reporter. This transcribe is using AI to transcribe. For me, isn't any different than me fax writing on a piece of note every word that comes out of my mouth and every word that comes out of the patient's mouth. There's no voice recorded anywhere, it's not going to the cloud. And then the AI, the generative AI, is going to take that transcript and turn it into a note that's suitable. So this is beneficial to us, beneficial obviously to the patient, for the sake of accuracy and other things. The law went into effect, which everybody may take this, that you are obligated to document it in your chart, and perhaps you're obligated to let the patient know. That only applies to Android, to autonomous systems where the clinician is not involved. In this case, clinicians are involved. The patient is being seen by you, and there is no need to. There is no obligation to document this in the chart, nor is there any obligation, or at least I can stand corrected if anybody else interprets that law differently. There is no obligation to let the patient know. It is recommended that we do, it only makes sense that we do, but it isn't something that we have to have consent, we have to let the patient know, we have to document the charts. We do document the chart that there's not a transcript by AI. We do let the patient know as much as possible. And generally the patients don't have a problem with it. And the way we explain it is, listen, this is like somebody sitting here writing everything that you said, exactly what it is. The other comments that I want to make, the platform that we're using is not really simple, right? I wanted to know if this is type behavioral health specific platform, or it happens to have different modules that helps with that, and also give that under
Yeah, that's awesome. Great commentary, Dr. Shansub. My name is Numan again. Just by way of introduction, I'm the founder of this product called CliniScripts, and you touch base on a few things, so I'll try to clarify. Firstly, CliniScripts is 100% focused on mental health. Okay, so that was always our focus, and that is still our focus. Yes, can we do note-taking for other disciplines? The answer is yes. But for the last 1.5 years, we have been working with University of Toronto. We've been working with at least 4 clinics, and now many more therapists to actually improve the accuracy of the notes that we generate. Okay, so I hope that answers your question, that this is 100% mental health and behavioral health focused AI note-taking tool. So having said that, there's a lot of other things that we are able to do, like assessments, and you talked about privacy first, and I know Dawn also talked about how we are different in the marketplace by making sure that there is no data actually that comes to our server. Everything stays in your computer. So the point I'm trying to make, privacy first, is our mantra, focused on mental health and behavioral health. That's what we are building this company around, and we will be bringing in many more features besides note taking, something like a 24/7 chat, an assessment tool. We have already developed that. So the idea basically is that this will help a lot of mental health professionals become more productive and save a lot of time. Now, just in the interest of time, I'll keep it very brief. This is the website. You can click on this link on the top, again, CliniScripts.com. I don't want to do a big demo or anything. I know we are only 4 minutes left here, but you can connect with Michael Lloyd here. He's my partner, and he will be more than happy to give you a one-on-one demo. But high level, one of the key things I definitely want to highlight, once you do register, you can log in using Apple and Google, and it's very easy to log in. One of the key differentiators that we have put in, that we will be launching very soon, is the capability to understand different languages. So if I can show my screen, like, yes, we are able to integrate with your EMRs. We link up to your, like, whatever notes that you want to create. We are available 24/7 to help you on if you need a question answered. But one of our biggest differentiators, besides the privacy, besides the mental health focus, besides having a lot of other features focused on mental health, is the capability to understand most of the languages. I think we're doing about 60 plus languages. So here I just wanted to show, if you go into and sign up, which I will strongly encourage you, we will also be launching this feature where the patient can speak in any language, because we've heard and we've seen that in mental health, a lot of patients might be more comfortable in their own explaining their issue in their own language as well. So that'll be another big differentiator that you can see in a one-on-one demo with Mike. So with that, I'll take a pause. I promised myself we're not going to, like, this wasn't a marketing call, but happy to answer a few other questions. Okay, so I think Dawn is saying that just building on Sean, what you said, there's a couple of clients who have, I think she sees a lot of patients, except for maybe a couple of clients, nobody has said no to CliniScripts. I think there's another question from Cooper Andre. What key policies should be in place to safeguard client confidentiality, ensure compliance, and maintain accuracy in clinical documentation? Mike, do you want to answer that?
Yeah, and hopefully I'm interpreting the question correctly. So for the purposes of client confidentiality, the application, in fact, the entire architecture is designed so that there's no data that is stored or saved in the cloud or on any servers. So the final output is simply resides on the device in which it was transcribed and produced. So once all the processing is complete, there's no data anywhere. In terms of confidentiality, there's no names saved. The only thing that would be saved is just your login information and your metadata from a practitioner standpoint. We do have signed legal agreements with our processors, BAAs as they're referred to in the industry, to ensure that they comply with these regulations for HIPAA, PIPEDA, PHIPAA. And then just from a practice standpoint, then we do provide just a consent reminder that it's worth speaking about, or letting your client or patient know that you'll be using a transcription service, and you can always be transparent and get their consent. We do have some other safeguards within the application that can vague out and anonymize the nature of the conversation as well. And you will always have the opportunity to edit a note or a transcript. So you can manually just scan and investigate your final output and make any manual changes that you need.
Excellent. And just posting here on our website, there's a whole section on privacy policy. We're so confident with our privacy policy and being a big differentiator. We have actually summarized our security audits and our threat risk assessment summary as well. So please go to our website. You can share with any cybersecurity expert, and we're happy to, as I said, answer any and do a quick demo as well. Last question. I think Dawn is asking, will you be linking with OWL? The answer is yes. We are. I don't know, Mike, what's the latest? I know we have integrated already with Clinical, OWL, and Jane. Do you want to take that question as well, Mike?
Yeah, I mean, it's certainly our endeavor to partner with the well-known EMRs. So we're having partnership discussions. They're at various stages. I think some are more open than others. Some EMRs are more likely to try to maintain a closed system, and some are taking more of a marketplace approach. So with respect to OWL and Jane specifically, right now Jane, you can copy paste into Jane, but there isn't a direct link, and that's not in the foreseeable future. OWL, I think we've had some discussions, but again, it's probably not a near-term solution.
Excellent. I'll try to respond to Tommy directly, but thank you so much. I know we are a couple of minutes over time. Again, I thank everybody for joining, and especially Dawn yourself for your amazing input, and always great to hear from you. And thank you everybody for your time. Thank you.